Out of curiosity, how long do you give your patients?
Always an hour.
An hour?
Always an hour. Well, an hour's slot, so 50 minutes minimum, yeah.
Pretty unusual, isn't it? I mean, most people are doing 30 for follow-ups. I get the impression it's 30 minutes for follow-ups as a rule.
But then my patient cohort are generally patients with chronic pain, or chronic back pain, or chronic musculoskeletal pain. So there's often something else going on. So we have time to be slow and time to breathe slowly. And then I would often also say, you know, take a few breaths, have a little walk around, right? When we think we'll do something in a minute, but the psychologists and psychotherapists talk about completing the stress cycle, right? So something stresses you, you notice that it's stressing you, you have to do something to get rid of it. And there are a whole host of evidence-informed ways of doing that, right? Movement, breathing, being out in nature, having an interaction with someone that loves you, getting a hug, right? That oxytocin, lots of different ways in which we can do that. So how can we help our patients do, you know, some of that is, I think, our work. And so what I would do in practical terms is I would start slow. I would sometimes just ask the patient to lie down and breathe to start their treatment. But perhaps before that, I would also ask them to do a little movement. So the simplest thing often, especially if they come in with this, you know, sympathetically charged fight ready to go, is just to do a very simple shoulder roll. Right, so are we all right to go? So you can do this sitting down, you can do it standing up, just to let your arms be relaxed and maybe even stand up maybe. Okay. I would say and you know, the viewers, some of them have met me before. I'm not really embarrassed very often, so I would just say, come on, just have a little walk around or walk with me. And I would say, you know, shall we have a little walk? Yeah, and just let things be floppy. Sorry, everyone. Sorry. But just to have a little walk around and shake things out. So shaking, maybe give your legs a shake. Shaking is is a movement that is considered to help release the stress.
With some evidence behind it, or is this unproven?
I need to go and check. But if you think sort of, again, osteopathically, Ayurvedically, so the science of yoga, we're talking about unblocking things that are blocked, right? So the rule of the artery is supreme. We want to get a little bit of movement. So just roll, and so having shaken your arms, so just shake.
Okay.
Yeah. And then just roll one shoulder back and roll the other shoulder back. And you can get them to do this. You don't have to, you know, you could get them to do it as a part of your assessment.
Yes.
Right? How does that feel in your neck and shoulders?
Lovely.
Yeah. You don't have to say that.
Okay. Painful.
Is it painful?
No.
Okay. So everything obviously always in a pain-free range, but why not ask them to do some little movements like that, right? And then along with the shoulders.
This is quite rigid here,
like
isn't
a military thing.
Okay.
So stop
for a minute. It's
XRAF. Oh, okay, there you go.
Doesn't count.
And then the other, so before we go into more movement, I would also suggest that they just breathe. And the simplest breath, and we've done this so many times now, is the So let's sit down just for a minute. So inhaling through the nostrils and then exhaling through a soft open mouth. So inhaling and exhaling. You don't get low blood pressure, do you?
I couldn't tell you.
Okay, so if you feel like you're going to faint, we'll
all right,
catch you.
okay,
Yeah?
okay, right.
So this is called, so carry on, do a few more. Inhaling through the nostrils, exhaling through a soft open mouth. So not a foo, but a. It's called the physiological sigh. There's all sorts of papers and stuff on it now, but it's yoga invented here first, slow yoga breathing.